Spleen 12 is on the lower abdomen, level with Ren 2, 3.5 cm lateral to the midline, lateral to the femoral artery. Spleen 16 is 4 cm lateral to the midline, level with Ren 11, 3 cm superior to the centre of the umbilicus. Gallbladder 24 is 4 cm lateral to the midline in the 7th intercostal space. When you palpate this point, make sure that you are in the intercostal space, not on the rib. Stomach 22 is 2 cm lateral to the midline, at the level of Ren 11, which is 3 cm superior to the centre of the umbilicus. Kidney 16 is half a cm lateral to the centre of the umbilicus. Kidney 18 is level with Ren 11, 0.5 cm lateral to the midline, 3 cm superior to the centre of the umbilicus. Do12 is on the posterior midline, below the spinous process of T3. Ren 12 is 4 cm superior to the centre of the umbilicus, on the midline. Ren 13 is 5 cm superior to the centre of the umbilicus, on the midline. Ren 14 is 6 cm superior to the centre of the umbilicus, on the midline. Ren 22 is on the anterior midline in the suprasternal fossa, 5 cm superior to the suprasternal notch.
Large intestine 11 is located at the midpoint between lung 5 and the prominence of the lateral epicondyle of the humerus. Typically, this is at the end of the transverse cubital crease when the arm is fully flexed. Spleen 4 is located in a depression which is distal and inferior to the flare of the base of the first metatarsal. Feel along the inferior border of the first metatarsal, find the flare of the base and place your point in between that flare and muscle. Spleen 4 is about 1 cm proximal to spleen 3. Be careful when palpating along the inferior border of the metatarsal that you don't overshoot the head and find this nice dip in between the medial cuneiform bone and the base of the metatarsal. It's a nice dip, but it's not spleen 4. Spleen 8 is located 10 cm superior to the prominence of the medial malleolus, half a finger breadth posterior to the medial crest of the tibia. If you're having problems locating the medial crest of the tibia, just raise the foot slightly and this should enable you to palpate it. Don't press too hard. This point can be quite tender on women. Stomach 36 is located approximately 13 cm superior to the prominence of the lateral malleolus on the anterior border of tibialis anterior. The easiest way to find it is to palpate down the tibial tuberosity. Find the base of the tibial tuberosity and move slightly laterally until you fall into a nice dip on the anterior border of tibialis anterior. This point is also 3 sun inferior to the inferior border of the patella.